Hello everyone, I do hope you are all well today. Thank you for joining us to cover our tutorial webinar on USP 788. For those of you who are new to our monthly webinars, you are most welcome. And for many of you who come to our monthly webinar tutorials, you're welcome back. As usual, if you have any questions, type them in and we'll get back to you with a follow-up to all of your questions. So please don't be shy. I love to get questions and get the conversation going. Or if you want to email me outside of this, I'll be showing my email address later. So let's jump into it. I wanted to cover USP history as we go back in time a little. Injectable solutions were commercially available in the 1890s, with the first monographs mentioned in the British Pharmacopoeia in 1898. The United States Pharmacopoeia introduced monographs in 1905. A monograph is basically a study of a single specialized subject. So we can see there were studies on the injectables back then. And remember, clean rooms weren't invented back in 1905 or even existed. The mentality around sterility and everything else was probably just starting in its infancy. So I don't think I would want to take one of those injectables back in the 1890s because there's no real way of verifying how sterile they were, and they're going to go right into your bloodstream. Anyhow, let's move on with history. So it wasn't until the 1930s that injectables were sterilized and tested for clarity using optical inspection methods. The liquid particle counters were not yet invented. In fact, they didn't make it into the early to mid 60s. In USP 12, the injection solutions were to be substantially free of visible particles. However, it was difficult to quantify what substantially free actually meant if you factor in human bias. And not surprisingly, the requirements were abandoned due to lack of any clarity. Let's fast forward on a little bit. We have some more points on the problems with particulates in IV solutions and injectables. In 1966, the FDA organized a symposium which made some impact on out of this event. An inspection method of membrane filtration and using microscopes was pushed forward. Liquid particle counters finally made their way into USP standards in 1985 with the Hayek-Royko unit. Here we go, isn't it? Nice image of it. And after that, more manufacturers go onto the market with liquid particle counters. Here we see the global regulations in the USA, Europe, and we'll see more in the next couple of slides. I wanted to touch base a little on the new updated USP standard, the USP 1788, light obscuration method for determination of subvisible particulate matter. It was officially released in May of 2021. And USP 1788 is an informational chapter complementing the USP chapters of 787, 788, 789, and 1787. In USP 1788, for the first time, flow imaging is introduced as a complementary test to light blockage test for injectable drug products using the liquid particle counter. So they're now talking about new technology using flow imaging. USP 1788 outlines the instrument standardization test requirements and also system suitability testing, and it refers to a standard called USP 1058. Now, that's an interesting standard. USP 1058 is a standard for analytical instrument qualification. It's worth checking out, by the way. And since its introduction, USP 1058 has evolved into the golden global standard for analytical instruments and the qualification of them. USP 1058 suggests that system suitability tests should be performed along with every sample analysis to ensure that the system's performance is acceptable at the time of the test. Now that's a significant one. So traditionally, and outlined in USP 788, for example, the testing of the system, when we say system, we're talking about the primary method, the liquid particle counter. The testing of that instrument is to occur every 6 months. So we're going from 6 months down to every time you use it, basically, to sample your product. That's a big step. Now, since it was released in May 2021, interesting to see on the adoption, how many companies are actually going to adopt USP 1788 and also follow the requirements of USP 1058. That's going to be interesting and a good topic for future webinars as we move forward. So for particles counting and sizing tests, USP 788 recommends routine testing using microsphere test standards and background count check using either filtered drug product or water blanks. So we're seeing an increase in effectively what we've been doing every 6 months with USP 788 validation of the liquid particle counter. So that's really an important one to watch out for. Again, just outlining parts of 1788. 1788 Part 1 looks at the light obscuration method, the light blockage method, or light extinction method using the liquid particle counters. Part 2 looks at membrane microscopic method, and then Part 3, the flow imaging method I talked about. So it comes in 3 parts or 3 subdivisions. And I just wanted to make you all aware of that as we move on. But as I said, we're going to be focusing on USP 788. And here are those other standards from Japan and Korea. I want to highlight that in all of these standards, if you were to work your way through them, they do mention 2 methods. The primary method being the liquid particle counter, and the secondary method being the optical microscope. And as I said before, the secondary method can complement the first method if you're having some high failures and you're not passing the requirements of USP 788, for example. And let's focus a bit on USP 788, which is the main theme of this webinar today. But first, I want to just talk a little bit about USP 787 and USP 789. So there's a couple of standards that USP defined for testing injectables and parenterals for particulate contamination. We have the USP. I want to provide you with an overview of USP 787 and USP 789, just so you're aware of their existence. USP 787, subvisible particulate matters in therapeutic protein injections, requires testing of the product in smaller volumes. Similar test to USP 788, but the volumes are smaller. And so it has a modified testing requirement to that of USP 788. The protein injections typically come in very small volumes, so I guess they're trying to save on the cost of the product, and they're just testing smaller volumes because of the nature of the product and the volumes that it comes in. Normally they're basically dedicated for patients and single injections, etc. Looking at USP 789, particulate matter in ophthalmic solutions. In other words, products like contact lens solutions, eye products for if you get red eye, stuff like that. Again, when you put these solutions into your eye membrane, you're bypassing your immune system, so they have to be sterile. So in the case of 789, the general chapter is closely related to 788 in the same way of the analytical testing for method 1 and method 2, LPC and the microscope, but their size criteria looks around the 50 micron range is added, as well as the 10 and 25 microns. I want to this kind of takes me back to my early days. I'm talking about 25 years ago. I did work quite extensively in a company called Allergan, and they had a subsidiary called Allergan Botox, where they did make the Botox solution. Botulism. A lot of people are using that today. They get the injections in their forehead and around their face. I believe it's good for wrinkles and all that. But I spent a lot of time in Westport, where this big facility was located. I implemented a lot of monitoring systems in that facility over the 25 years, and I loved going there because look at this place. It's really beautiful. This is Westport in the west of Ireland, a beautiful little town and a great coastal area. Lots of great restaurants and places to visit. So I really love working there, and that's a bit of a blast from the past. And that's a little bit on USP 789. Okay, let's get back to focusing on USP 788. For anyone unfamiliar to what a parental drug is, and I'm not talking about beer or wine. I know raising kids these days is pretty tough. However, in today's context, a parental drug is basically a non-oral administration of medication related to injecting directly into the body. With this method, your natural immune system is bypassed and the drug goes directly into your body and bloodstream. So the risks are pretty high, especially if the patient, for example, is already sick with a weakened immune system. Think about a patient undergoing a heart transplant, one of the most invasive operations. You definitely do not want a contaminated product entering this patient's body. It could potentially kill them. So the risks are high, and therefore the testing using accurate equipment such as a liquid particle counter is scrutinized using traceable calibrations and validations that we'll get into them in a little bit more detail later on in the presentation. The United States Pharmacopoeia, USP, provides two tests for detecting such particulates. As I say, the light obstruction and the microscopic um, physical test. Both are generally accepted for use in testing large volume parentals, small volume parentals. Commonly, samples are first tested by the particle counter, the liquid particle counter. If the sample fails, then it fails to specified limits. The microscopic assay method, the testing using the microscope is used to try and identify the particles. Parental drug administration, as I say, means any non-oral means of administration, but it is generally interpreted as relating to injecting directly into the body, bypassing the skin and the mucous membranes, and it goes into your bloodstream or into your muscle. So I want you to be aware of the administration of parental drugs. It's important. USP 788 tests for particulate sizes in a range greater and equal to 10 microns and greater and equal to 25 microns. In the next few slides, we'll shed some light on the reason these particulate sizes are of significance. Overall, we must remember USP 788 places limits on the amount of subvisible particles allowed in injections. The risks are really high, so let's see why particulate contamination can be so dangerous. As you see from the charts in this slide, capillaries, venules, and arteries have mean diameters of 8, 20, and 30 microns respectively. Blockages can cause significant harm to patients. Blockages prevent the proper flow of blood, oxygen, and nutrients throughout the body. As we know, most people on IVs are already in a weakened immune state, so this can further compel the problems and even lead to death. Particulates in the vascular system can cause blockages, emboli, and chronic damage to organs over time. Particulates in the extravascular system can trigger immune responses and iron tissue damage. So as I say, testing for contamination takes on a major significance. The test data must be of the most accurate type you can get because you're going to be pumping out product that you want to be assured is free of contamination. The risks are high. How high? Solutions with pathogen contamination do occur, and the risk of death is real. Let's reflect on a real-life incident in 2011 in Alabama where 9 out of 19 patients who received contaminated IV solutions died. The owners of the company and some of the managers who supplied the products are all sitting in jail cells. However, the patients they died, 9 out of 19. So the stakes are high, folks, and fatalities do occur from oversights and human error, or sometimes just malfeasance, where data is not scrutinized enough or data is knowingly passed when it should have failed. Whenever there's money involved, the limits of human behavior are limitless. So I think that particular issue was a good example of greed, and the perps are in prison with long sentences. So particulate matter can be extremely harmful when introduced into the bloodstream. It can cause adverse reactions in the patient, such as what we talked about, vein irritation, local tissue infarction, even anaphylactic shock, and even death, as we've seen in the past slide. So most injectable products are not thermally sterilized, which can present a risk that must be mitigated for patient safety. Therefore, it is really crucial to ensure that your product testing procedures are followed correctly and the right equipment and processes are used. Your LPC liquid particle counter needs to be fully calibrated and validated every 6 months. Validation is a requirement, and it is important that the LPC is verified as accurate. An example here of our validation document is a full validation process that we follow using traceable latex spheres of a known concentration to verify the unit's accuracy. So USP 788 requires two methods that we've already mentioned, one using a liquid particle counter and another with a microscope. In method 1, using a liquid particle counter, the light obscuration particle count test is used to examine injections and parenteral infusions for subvisible particles. A vial or a pool sample of vials from the product are sampled by the instrument in a clean environment. The instrument measures the number and size of particles in the injectable formulation and the results compared to USP requirements. So we'll only be focusing on method 1 in this webinar tutorial today. Let's go and look at this method in a little more detail so you understand the technology of the light obscuration or light blockage method. And the microscopic particle testing is used as a secondary supplement to the primary if, for example, the results are failing, then the sample is filtered and an optical test is done with the microscope to verify what type of contamination. And contamination can vary. Contamination can be, pathogenic in nature. The contamination can be pieces of the product, plastic, pieces of, anything from the clean room. Whatever contamination is brought in there, as shown up in some of these tests. Moving parts from the machines, and particularly in contact lens solutions facilities, I use blow fill seal operations. So it's pretty difficult to, it's not a clean operation. If you ever look at a blow fill seal machine, you know what I'm talking about. So advances in particle counter liquid sampling technology for the light blockage and sampling software have made the testing process less tedious and more automated. With the advantage of 21-Surf11 software, you can get this system automated and reports generated quite easily. And it's essential to understand this technology. So let's have a look at how a liquid particle counter works internally. All right then, so we have a diagram here on the left. Let me explain that a little bit as I get my laser pointer. Here we have the laser diode. It shines a laser light across to the photodetector. The photodetector is a device that will pick up light energy and it will convert it into a voltage signal. So in this diagram, we see the light beam. We have an area here called the view volume. This is the area where the particles flow from here. They're being sucked up and they go through the view volume and they'll hit the laser and they'll block some of that light depending on the size of the particles. And then they are flushed out of the system. Usually you probably see behind a beaker with a drain that will come out from the back of the unit and drain the sample. You don't want it flushed out onto your working surface. Anyway, that's a good idea of how the sensor looks inside. We have the sensor location up here. You take off the cover here, you'd see the sensor behind here. And this is where the flow comes. You have the sample inside the speaker, flow pad. The sample is pulled through, the syringe will suck down and take the sample through into the sensor. And then the sample is drained into a beaker at the back. Or it can be plugged in to drain into a sink or something. So let's take the cover off this particle counter. You see here's the laser. Another angle of the sample inlet pulls the sample up through as the action of the syringe works with a known volume to be sampled, and the particles will go through and they'll block the light and they'll be counted and sized. And here we have a diagram of a sensor with a particle passing through it. So you notice now what you see here is the laser light is not falling directly onto the photodetector. So you see a reference voltage here dips down. So it's this delta here that's measured to give you the magnitude of the particle, because this typically when there's no blockage, the reference voltage goes all the way across, and it's a known reference. So to get the size, you'll subtract the delta from the reference, and that'll give you the size of the particle blocking the light. And that's basically how it works. It's a pretty simple concept. It's also known as light blockage, light extinction. It's a pretty simple concept. The laser, it does its job. It shines the beam across. The photodetector picks up that beam. All that is calibrated. It's known. It's referenced. As soon as the particle passes through, you'll see a drop in the voltage, and that's how you're able to size and collect and count the particles. If you're wondering how the sample gets through the sensor, I did talk about the syringe and the action of that syringe pulls it through. Here we see the syringe mechanism. The syringe is used to ensure an accurate sample volume is taken. The sample is pulled through the sensor, as we saw, and with this system, specific volumes can be programmed into the liquid particle counter software based on the size of the syringe, and you can get larger syringes, and that ensures repeatable and accurate volumes taken. So because volume is really important, and that's a segue into our next slide. We'll look at these volumes. So let's talk a little about volumes. A large volume parenteral, the LVP, is a unit dose container with a volume greater than 100 milliliters. A small volume parenteral, a SVP, is a catch-all for all non-LVP parentals. It's important to understand the differences between SVP and LVP, small volume and large volume parentals. The IV or vial products are categorized into either based on volume. So understanding that is important, because the standards are based off of the number of particles per milliliter based on the size of the volume taken. As mentioned in the previous slides earlier, the stakes are high, so liquid particle counter accuracy and repeatability are paramount. For the USP 788 test method, the test is carried out under conditions limiting particulate matter. Preferably have the LPC in a laminar flow hood, grade A or ISO 5 environment, so that the environment itself is not introducing contamination. We do not want the environment to be a source of contamination during the testing, as the samples are taken from an open enclosure. You've got your sample in here in the beaker, so it's important to have a location like a flow hood cabinet, a biological safety cabinet, or a laminar flow hood will do the job, and an operator gowned up correctly, wearing gloves and all that. When testing a single unit, this testing can be used for large volume parentals. If the parentals are less than 25 milliliter in volume, then up to 10 units can be tested with a combined volume of 25 milliliter. So you could test 2 or 3 or 5, depending on your SOPs. as long as they combine to a 25 milliliter volume. Now, it's important that if you're using glassware, it's very careful that you wash the glassware using filtered water and a warm detergent, and then using sterile water. Remove all traces of that detergent, and then rinse it out with sterile water before mixing the sample or adding the sample into the beaker. Or you can directly sample into the vial itself. Always remember, during the test, the first test result is disregarded. This eliminates picking up any residue in the sensor from previous samples, or, obviously you'd want to flush the sensor out first. In fact, there's some tests that you do called blanks that you will verify that the system is clean before you actually start testing the product itself. It's also part of the validation process. And you can get test kits from various manufacturers which will have blanks, which will have a number of particles per milliliter that you can verify the unit is accurate. And that's a whole section to talk about. Maybe a future webinar on USP 788 validation. We can definitely look into that if we have people interested. It's a little bit of a process. Here we see the limits for small volume solutions and large volume solutions. In small volume solutions, like less than 100 milliliter, the average number of particles must not exceed 6,000 per container for less than or equal to 10 micron, or 600 per container for less than or equal to 25. For large volume solutions greater than 100 milliliter, the average number of particles present in the units tested does not exceed 25 per milliliter for greater or equal to 10 micron, or 3 per milliliter greater or equal to 25 micron. As I said, in step 1, the glassware is washed thoroughly, and the sample is introduced, or it can be taken directly from a vial. As I said, you need to at least make up a sample volume of 25 milliliter if you're going to determine a small volume product, and it's run through the unit. In step 2, the samples are taken, and the liquid particle counter will eliminate the first sample and the data and calculate the mean for the remaining sample vials or volumes that you're taking, and it will give a pass or fail report. Now, today's liquid particle counters, they come with 21 CIR411 software, so all calculations and data are made through the software, and reports can be pretty generally made easily through the system. So sampling with the USP 788 software, and the compliance does not need to be complicated or tedious. So recent advances in liquid sampling technology have made USP 788 compliance simple yet effective. Liquid sampling aids in your contamination control strategy to keep particulate contaminants out of your injectables and out of the bodies of the end user. So the liquid particle counter can be connected up to this software. And here we see a simple logon sequence. USP 788 standard can be loaded. There's a good diagram here of an actual software. It's the software that we use in our LS20. And it does make the process a lot easier. Here we see a screenshot of a test which has a sample size of 5 milliliter. The recipe is USP 788, as you can see over there. And we see the cumulative average of the tests that's just done. And down below, we've got a table of all of the tests there and the average counts in this particular test. Whoops, let me go back there. In this particular test, we're looking at 10 microns, an average of around 5 particles per milliliter. 15 microns, you're looking at 1. 25 microns, you're looking at about 1. I'm kind of rounding up these figures. And 50 microns, you're looking at, anywhere you see a point. The decimal, just always round it up to 1 particle. And you can change the software here to give you the rounding already built in. Here we see an example of how a sample can be easily configured. Sample configuration can be easily made via the software. Alarms for specific particle sizes can also be configured. The sample can be stored and reused when required. If the USP is updated, for example, you can easily update your sampling to match the current update. Sample reports can be easily made and stored electronically. So the liquid particle counters of today make USP 788 much more easier to achieve and to evaluate product samples. So over the 150 years, we've covered, you know, with the 150 years when we went back in time looking at United States Pharmacopoeia and British Pharmacopoeia. It's only been the last 40 years that particle counters have been introduced. So, and our verification abilities have improved with the LPC technology. So the end result is for a safer product to be issued to the public. So let's talk about what we've covered today. We reviewed some history of regulation and standards from over 150 years. The first injectables were not fully tested, or was there any real means to test them other than a visual optical test before moving onto filter membrane and microscope testing in the late 1960s? It was not until 1985, which was around 37 years ago, that liquid particle counters were first introduced for testing using the light blockage technique. We looked at global regulations for particulates and liquids. We did a quick overview of USP 787, the standard for subvisible particulate matters in therapeutic protein injections. Remember, those protein injections come in smaller volumes, so testing requires less volume to be sampled, but the test evaluation still remains on par with USP 788. We also looked at USP 789, which covers particulate matter in contact lens solutions, eye drops, for example. I talked about that nice place I worked in Westport in Ireland. We then took a deep dive into USP 788, but before we did that, we looked at how particulate contamination can affect the human body, and that was pretty interesting. We discussed the tainted IV solutions that killed 9 out of 19 patients back in 2011 in Alabama. Shocking, really. In the USP 788 deep dive, we touched on the validation, the LPC technology of light blockage, also known as light extinction or light obscuration, and the evaluation. And we noted how simple the testing is when using software and automating the testing with samples and recipes becoming pre-configured. So we covered quite a bit, and it's neat time to let you all go free. But before we jump off, let's look at some common Q&As. Let's jump into our Q&A session. Okay. Question number 1, are USP standards harmonized with other international standards? Yep. So here's a comparison of the United States Pharmacopoeia, Japanese Pharmacopoeia, and European Pharmacopoeia. And you can see when you look through there is definitely some harmonization. And it's particularly in the evaluation and the results. So there's harmonization in the USP standards for sure. How is the LPC validated for USP 788? Okay. Again, I did say that's a topic for a whole webinar by itself, but let's just go through some of the requirements. So USP 788 validation and calibration intervals are on a 6-month basis, or even if you move the sample, you need to revalidate. The basic validation requirements include the verification of the validation is acknowledged when the liquid particle counter passes the count ratio testing using 15 micron particles, and the corresponding counts should fall within 10%. So you can get test standards, test references, latex spheres, you see like these bottles down here, and they will have a known volume, a known concentration of particles at a particular size. For example, let's say these are 15 microns and you run them through the test. When you run these particles, you just basically, you'll flush out the unit, you'll make sure you got your blanks, you make sure that there's no contamination within the system. You basically would invert this 20 times, let it rest for a little bit, and make sure there's no gas bubbles. You will then put the sample into the inlet tube, you take off the cap, and it will take a couple of volumes and it will calculate the average. As long as you meet that 10% requirement for count accuracy. So if you have this concentration, say 3,000 particles per milliliter, you should fall between 2,700 and 3,300, anywhere between there at the 15 micron size. That is that will enable you to verify that you've passed the test. So the basic validation requirements also include sample volume verification, the volume accuracy test, sample flow rate verification. You also calibrate the sensor during the test. You also do a sensor resolution test using 10 micron test particles. The count ratio test, you use the blanks test using clean particle-free water. And then the count ratio test that I've just explained using the 15 micron particles. They're called count cal. And as I said, they usually have a concentration of 3,000 particles per milliliter, plus or minus 10%. So the verification of the validation is acknowledged when the liquid particle counter passes the count ratio test using these 15 micron particulates. And the corresponding counts should fall within 2,700 and 3,300 particles. That's at 10%. And it's a simple but effective validation of the accuracy of the liquid particle counter. And it's very thorough as well. It takes a bit of time. You could spend about half a day to a day running through it. How is a liquid particle counter able to count particles? We touched on this. I have the two diagrams here side by side. You can see what happens. You know, there's no light blockage, and the laser hits the full. The photodetector picks up the light from the laser. Here we have a blockage. We have particles blocking light that cast a shadow on the photodetector, and then we're able to basically check the reference voltage and compare the magnitude that it's dropped, and that's how the sizing of that particle is achieved. It's quite an interesting but easy process. Let me just go into it a little bit more detail, because here we see the laser without any particles present in the view volume, and you have that reference voltage. As soon as you start to detect the particles, that reference voltage will start to drop. Here we go. This is the slide I wanted. You see over here, you got a particle, it's blocking the laser, hitting the photodetector, and you have a drop in that voltage, and that's basically the magnitude of that particle will cause that drop. And it's as simple as that. So I hope that really gives you a good overview. Also, before we go, I want to let you know about next month's webinar in the next slide. And if you wish to expand your knowledge, we recommend you get onto our Knowledge Center. We've definitely put a lot of work in there over the last couple of months. And you'll find a comprehensive vault of useful information on environmental monitoring, cleanroom technology, cleanroom standards, and much, much more. It's all free, folks. We've got past webinars in there as well. So I would strongly recommend you check it out. You won't find such a complex library of information anywhere else on the web. We've definitely put a lot of energy in here to empower you, to give you the knowledge. So jump onto our Knowledge Center on our website. You'll get onto our main website, and there it is, there, Knowledge Center, and you can log in and you can set up your own account. And I'm also going to be working on training modules coming out soon as well, probably within the next 3 to 6 months. So that will be attached to our Knowledge Center, so you can actually get certified and trained up on many aspects of cleanroom technology, cleanroom standards, environmental monitoring, certification. So that's on its way as well. And that'll be interesting. That again, we're just adding on more knowledge and enabling you and empowering you, the end users. Okay, next month. Woo! Getting excited here. I'm very excited to be actually to announce next month's webinar. It will be hosted by Hashim Solmaz out of the EMA region. He's based in Turkey. He's a general manager of Lighthouse Worldwide Solutions in the EMEA region. And Hashim is a gem of a presenter, a wealth of knowledge. I love watching his webinars. They're very interesting, and he has a great way of presenting. So next month's webinar in March will be based on good application practice of how to perform a proper cleanroom classification. So if you're using a particle counter and it's your job to do the certification and to do routine monitoring, I definitely would jump onto this, or even certifiers, jump onto this webinar. And I encourage you to register for this one. We'll be sending out notifications. You can jump onto our website in a couple of, I think, a week or two. Definitely notifications will be out by then, but please don't miss this one. This is going to be a really good one. As for me, that's about it. My email address is there. If you want to contact me, we can shoot the breeze on everything particles, and I guess that's all for me today, folks. I will be back again for another tutorial webinar in the near future. And if you wish, as I said, get in touch. My email address is there. So until next time, folks, spread the love, and don't forget our Knowledge Center and Hashim's webinar next month. And take care of yourselves. Adios.